Stomas are surgical openings in the neck that allow a patient to breathe. These airways may be created when a person suffers a trauma or illness that prevents normal breathing through the mouth and nose, requiring them to have been on a respirator for an extended period of time. When you find patients with a stoma in severe respiratory distress or respiratory arrest, you may assist ventilations through the stoma. As with other uses of the bag valve mask, 2 rescuers are recommended for the most effective ventilations. Attempt to ascertain information about the stoma, such as the reason it was placed, when it was placed, and whether the patient relies entirely on neck breathing. In the case of a partial laryngectomy, for example, the patient may be able to take in some air by mouth or nose. In that case, you may be able to ventilate normally with a BVM mask over the mouth and nose. Now let's look at the specific technique of ventilating a stoma breather. Take BSI precautions. Remove any items of clothing, such as scarves or ties, from the area of the stoma. A training mannequin is being used for the following steps. Clear the stoma of obvious mucus plugs or secretions. Mucus plugs often obstruct the stoma, causing respiratory distress. Suctioning through the stoma may be necessary with a suction catheter. If mucus is too thick to suction and the materials are available to you, consider injecting 3 to 5 cc's of normal saline through the stoma to break up the plug and aid in its removal. Leave the patient's head and neck in a neutral position. You do not need to perform a head tilt chin lift or jaw thrust maneuver on a patient with a stoma, as you already have a direct route into the trachea. Select a mask, most often a pediatric mask, that fits securely over the stoma and can be sealed against the neck. Hold the mask seal with your hand and ventilate the patient at the appropriate rate for his or her age, which is once every 6 to 8 seconds for adults and once every 3 seconds for infants and children. Assess the effectiveness of ventilations. Watch for chest rise and fall. Feel with your hand to be sure air is escaping back through the stoma upon exhalation. If the chest does not rise, suspect a partial laryngectomy. Seal the nose and mouth with one hand by placing the palm over the lips and pinching the nose between the 3rd and 4th fingers. Repeat ventilations. If unable to artificially ventilate through the stoma, consider sealing the stoma and ventilating through the mouth or nose instead.